Sinus surgery continues to play an essential role, most probably in restoring ventilation and in removing diseased tissue, probably setting us up to restore the sinuses back to normal. But where we're going to be better in the future is going to be once we've attained normalcy following sinus surgery is going to be coaxing that sinus cavity back into health. And this is where we hope that a manipulation of the combination of new agents plus existing surgical techniques is going to yield improved outcomes.
Since very long for this problem group, the eosinophil-driven disease, I am convinced, and I've been communicating that, this is the group of diseases of patients who will disappear from our table of indications over the next years or decades. I said that at the end of the 80s already. It has not happened until today. If somebody of the researchers, not the surgeons, will find that switch in our immune system, which is twisted to the wrong side, and come up with biological new whatever, this will be the end of most of the surgery, at least in our developed countries, for this kind of disease.
I hope sometime disappear, because biologic improves a lot, and I'm sure maybe I can't see it in my life, but maybe in the future we can get the target where we can use precise medicine for each patient, and we can use monoclonal for this patient and another monoclonal for that another patient. So this is the way I think the future of the endoscopic sinus, unfortunately for surgeon, I think will disappear.
You know, I think biologic therapies, as we have a more keen understanding of the underlying pathophysiology of CRS and all the different endotypes, we will know which patients may benefit more from just starting a biologic outright, and which patients may benefit from having perhaps just surgery and the conventional medical therapies like topical nasal steroids. So I think with our understanding of the disease, that's how we will determine, precision medicine will help us.